Hi Alice, it's very nice to see you again. I see here that you're having some problems with numbness on your skin.
Yes.
Alright, before we begin with the exam, can you please verify your first and last name and your date of birth?
Yes. Alice Smith.
Okay.
May 10th, 2000.
Okay. Do you have any new allergies?
No.
And when did this begin?
About a year ago.
Okay. And they come on gradually? Are they all over? Is there a specific spot that is more numb than the others?
It's kind of everywhere, all over.
Okay. I'm going to take a look. First, do you take any medicine on a daily basis?
No.
Any vitamins that I should have on file?
Just a multivitamin.
Okay. And have you noticed any changes in your vision?
Slightly, yes.
Okay. Is it in both eyes or just one?
Both.
Both eyes. Okay. Any blurriness?
A little bit.
Any changes in your smell or taste?
Yes.
And any changes with your hearing?
No.
I'm going to go ahead and just start the exam. I'm going to first put some gloves on and we'll take your vital signs. Are you experiencing any pins or needles in your extremities? Okay. I'm going to take your temperature. This will go on your forehead. Let me fix that. Okay. 96.6, that's good. And I'll take your blood pressure. This will go on your upper arm. Okay, relax. So go on the elbow. Blood pressure is 120/70. That's normal. Good. Are you experiencing any headaches?
No.
I'll put this here. I'm going to first check your nose, since you did say that you're having some smell problems. I'm going to have you look up for me. I'm not noticing any redness, so that's good. Now I'm going to go ahead and check patency. Go ahead and breathe in and breathe out. Good. Breathe in, breathe out. Good. I'm going to have you try to identify the smell.
Peppermint.
Okay. That's normal. What about this one?
Spearmint.
Okay. That was sage. Let's go ahead and try one more.
Sandalwood.
Okay, that was like a lemon citrusy. So there's definitely something there. Let's go ahead and check your mouth. I'm gonna have you give me a big ah. We're looking for asymmetry, also redness or swelling. I'm not noticing anything abnormal. Can you go ahead and push your tongue up and down for me? Good. And side to side. All right, that's good muscle coordination. Now I'm going to put this tongue inside your tongue on one side of your cheek. I'm going to have you try to push it, okay? Go ahead and open. And now try to push the blade. That's good. Let's go ahead and do that one more time. Perfect. Okay. And can you give me a big smile? Okay, that's symmetric. And frown. Puff your cheeks. I'm gonna have you keep them puffed. Don't let me unpuff them. Good. Relax. Now I'm gonna have you shrug your shoulders. Good. And squeeze my fingers. Good. I'm gonna have you put your arms like this in front of you. I'm gonna try to push them down. Don't let me do that. Okay. I'm gonna try to open them. Don't let me do that. Okay. I'm gonna try to push them up. Don't let me do that. Okay. Good. Relax. And I'm going to put one drop of this on your tongue. I'm going to have you identify the taste, okay?
Minty.
Okay, that was just a sweet taste. So definitely there's some abnormality with cranial nerves, and we're going to go ahead and just continue and see exactly what we have here. Let's go ahead and check your vision. Do you wear contacts? No. Okay. I'm going to have you look behind me straight at the wall. Good pupillary response. I'm going to press down on the eyelid. Okay. Now I'm going to have you look right here. And look right here. Okay. I'm going to have you cover one eye. And can you go ahead and read the first sentence?
Hold chart 6 feet from eyes in good light.
All right, go ahead and switch. And read the second sentence.
Check eyes separately, not with and without glasses.
Okay, that's perfect. And what color do you see here?
Red.
Okay. Vision is intact. I'm not noticing anything abnormal. All right, I'm going to have you now lay down and we'll examine your scalp. I'm going to just take the hair and put it on the side here. Starting with the side. I'm looking for skin issues first. I'm noticing a little bit of dandruff. And some redness. But otherwise, there doesn't seem to be any lice infestation or raised papules. me if you feel less pressure here.
Yes.
What about now?
No.
And what about here?
No.
Okay, so you don't feel anything on that side. Any pressure here?
Yes.
Okay. I'm going to touch you with just a puff of air. Go ahead and tell me if you feel this, yes or no.
No. No. No.
And now I'll touch you with a sharp or dull texture. Go ahead and tell me if you feel this sharp or dull.
Dull. Dull. Sharp. Dull. Sharp. Dull. Dull. Dull.
And do you feel this cold or warm?
Cold.
What about now?
Warm.
And now?
Warm.
And now?
Cold.
Okay. Go ahead and tell me if you feel this pressure point here.
Yes.
And here.
Yes.
What about here?
No.
I'm seeing a little bit of redness here on the side where you don't have any feeling. Go ahead and tell me if you feel 2 pressure points or just 1.
2. 2. 1. 1. 1.
And do you feel this sharp or dull?
Dull.
And now?
Dull.
And now?
Sharp.
What about now?
Dull. Sharp. Dull.
Okay, go ahead and tell me if you feel this puff of air, yes or no.
No. No. No. Yes. Yes. No.
Okay. Go ahead and tell me how many taps you feel, 1 or 2.
2. 1. 1. 2. 1.
feel this pressure point here?
No.
What about here?
No.
And here?
Yes.
Does this feel cold or warm?
Cold.
And here?
Warm. Warm. Cold.
Okay, go ahead and tell me if you feel this 2 or 1 pressure points.
2. 2. 1. 1. 2. 2. 2. 1.
Does this feel sharp or dull?
Dull. Sharp. Sharp.
Okay, do you feel this all the way?
Yes.
What about now?
No.
And now?
No.
Go ahead and tell me if you feel this pressure point here.
No.
What about here?
Yes.
And here?
Yes.
And here?
Yes.
Okay. Go ahead and tell me if you feel this cold or warm.
Cold.
Good. And here?
Warm.
And here?
Warm. Cold.
Okay, so it looks like around here we're gonna be focusing. Go ahead and tell me if you feel this 2 or 1 pressure points.
2. 1. 2. 2. 1. 2. 1. 1.
Okay. And do you feel this sharp or dull?
Sharp.
And now?
Dull. Dull. Dull.
Okay. Go ahead and tell me if you feel this all the way down.
Yes.
And now?
Yes.
And now?
Yes.
Go ahead and tell me how many puffs of air do you feel? 1 or 2?
2. 1. 2. 2. 2. 2. 1. 1.
Okay. Tell me if you feel this sharp or dull. Sharp. And now. Dull. And now. Sharp. Sharp. Dull. Dull. Sharp. Sharp. And does this feel cold or warm? Cold. 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 Warm. Warm. Cold. Warm. Warm. Cold. Cold. Okay. Let's go ahead and take a look at your back now. I'm going to first palpate the spine, looking to see if there is any abnormal curvatures, as well as any inflammation around the vertebrae. I am noticing a little bit of redness that shows some constriction in the blood vessels. Checking for any pulsations or changes in skin texture. Just slowly tapping on the spine. Looking for abnormal neurological responses. I'm going to touch it with a cold texture. Go ahead and tell me if it changes in intensity. Where did you feel it colder?
At the top. Yes. No. Yes.
And where did you feel it colder?
At the bottom.
Was that the same?
Yes.
Go ahead and tell me if you feel this pressure point, yes or no.
No. No. Yes. No. Yes. No. No. No.
I'm going to touch you with dull textures. Go ahead and tell me if you feel this on the left or right.
Right. Left. 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 Right. 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 Left. Left.
Now I'm going to touch you with two textures. One is going to feel dull. This is what dull is going to feel like. And the other one is going to be a little bit sharp, like this. Go ahead and tell me if you feel this sharp or dull.
Dull. Dull. Sharp. Dull. 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 Sharp. 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 Dull. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. 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 Dull. Sharp. Sharp.
And now I'll touch you with a wet or a dry texture. So go ahead and tell me if you feel this wet or dry.
Dry. Dry. Wet. Wet. Wet.
Now I'm going to touch you with 2 sensory brushes. Go ahead and tell me if it changes in texture or intensity as I'm sliding it down.
Yes.
Okay, where did you not feel it?
In the middle.
In the middle. Did you feel it all the way?
Yes.
Okay.
Yes. Yes. No.
Where did you not feel it?
In the middle.
In the middle.
Yes. No.
Okay, Alice. Just checking your lymph nodes to make sure that they're not constricting any nerves. Sometimes if they're swollen, that could happen and could trigger a series of symptoms. Just gently palpating to see if there is anything concerning. I'm going to check for any TMJ disorders. Go ahead and slowly open your mouth as wide as you can. And slowly close it. Let's go ahead and do that one more time. And slowly close it. Okay. I did not feel any clicks. Did you hear any popping in your ears?
No.
Alright, I'm going to touch you on your face. So we're checking for any sensory problems again. Go ahead and tell me if you feel this on the left or right.
Right. Left. Right. Left. 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 Both.
Did you feel that equally on both sides?
Yes. Both.
And did you feel that equally on both sides?
Yes. Equally. Equally.
Okay. Go ahead and tell me if you feel this pinch here.
No.
What about here?
Yes.
Okay. Let me know if you feel this pinch here.
No.
And here.
Yes.
Okay, so it's more localized on the left. What about here?
No.
Here.
No.
Here.
Yes.
Here.
No.
Here.
Yes.
Right here.
Yes.
Here.
Yes. Yes.
Okay. Go ahead and tell me when you don't feel the vibration anymore.
I don't feel it.
Tell me when it stops.
It stopped. 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 Stopped.
Go ahead and tell me which position here is louder, 1 or 2. This is 1 and 2. 1 and 2.
2.
Okay. I'm going to touch it with 2 pressure points. Go ahead and tell me if you feel this 2 or 1.
2.
1.
2. 2. 1. 2. 2. 1. 1. 2. 2. 2. 1. 2. 2.
2. And now I'm going to touch it with a sharp or dull surface. Let me know if you feel this sharp or dull.
Dull. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. Dull.
Now go ahead and tell me if this feels dry or wet.
Wet. Dry. Wet. Wet. Dry. Dry. Wet. 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 Dry. Wet. Wet. Dry. Dry. Wet.
Okay, so it does seem like the dermatomes on the left side, more like in the middle, are compromised. I'm going to go ahead and check your arms now, and then we'll move down to the leg area. Go ahead and tell me if you feel this equally on both sides.
Yes. Yes. Yes.
Okay, I'm gonna have you flip your arms like that. What about now?
No.
Okay. Where do you not feel it?
On the left.
On the left. What about now?
No. Yes. Yes.
Okay. So we're going to focus on those parts. Go ahead and tell me if you feel this bubble there, yes or no.
No.
Does this feel cold or warm to you? Cold. And now. Warm. Cold. Cold. Go ahead and tell me if this feels sharp or dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Does that feel cold or warm? Cold. And now, warm. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. Sharp. Okay. Go ahead and check your reflexes here. Okay. Relax your arm. Okay. I'm going to check your reflexes here. So I'm going to slide my arm right under your knee. Go ahead and relax. Good. A little bit of diminished reflex on the right side. Okay. Relax. Good. Okay. Very diminished on the left side as well. And now go ahead and relax your foot. We're just going to put it on top of the other one. Perfect. And okay, good. Same thing on the other side. Okay. I'm also gonna check Babinski reflex. Good. And we'll do that one more time on this side. Okay. And go ahead and try to pull your feet towards you, okay? Good. Now try to push with the pads. Okay. Go ahead and try to open your toes. Okay. Try to curl your toes around my fingers. What about the big toe? Alright, very diminished on the right side. Go ahead and tell me if you feel less puff of hair. Yes. No. Yes. Yes. No. No. Does this feel sharp or dull? Dull. And now? Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Dull. Okay, so cranial nerves are honestly all over the place. I'm gonna have you stand up and we'll talk about what we should do next. All right, Mrs. Smith, we're going to just order a few more tests. We're gonna do a CT scan. We're gonna check abdomen and neck and head. Now, I'm going to prescribe some medication as well. I think it's going to help to bring down some of the inflammation that you're experiencing in some areas of your body. And you might experience a little bit of side effects. Those are normal. I'm going to go ahead and write that down for you so that you, in case you do experience that, you don't get alarmed. And let me know if you have any questions for me, okay?
Okay.
All right.
Thank you.
You're welcome. It was very nice to see you. Okay.
The lips again. H-O-F. Cool. Sure. One. More. One. Sure.
Hi, Angelina. How are you doing today?
I'm alright. I could be better, but I've just been feeling some strange things, so I just wanted to get that checked out.
Okay. Let's go over some of the information that I have here. I want to make sure that the file is complete.
Okay.
Can you verify your date of birth?
July 21st, 2005.
Okay. And your last name?
My last name is Warner.
Okay. Do you have any allergies?
No allergies.
Are you taking any medications on a daily basis?
No, not that I can think of.
When was your last checkup?
About 2.5 months ago.
Okay. And are you experiencing any pain right now?
Not any pain right now, no.
What kind of issues would you like me to address?
So the past couple days I've been feeling like a weird tingling sensation going down my arms. And also I've noticed that my eyesight has been slightly blurry.
Okay, let's go over your vision. Do you wear contacts?
I do not.
And how long ago have you noticed this?
I'd say about 5 to 6 days ago.
And have you noticed that blurry vision in both eyes or just one?
It's mostly just my right eye.
Okay. And have you noticed any floaters or any colored things that float in your vision? No. So just blurry vision.
Yeah.
Okay. Okay, and for the sensation that you're having on your arms, is that on and off?
Yeah, it's pretty on and off. When it does happen, it lasts about 5 to 10 minutes and then it'll slowly go away.
And for how long has that been going on?
That's been going on for about a couple weeks now.
Okay, so we started with sensory problems on the arm. Any other loss of sensation anywhere on the body?
Not that I'm aware of, no.
Okay. Have you noticed that you're a little bit more clumsy or that you cannot hold a cup properly?
I've noticed that when I get up pretty fast, I tend to get a little lightheaded, but other than that, no.
Okay. How well do you sleep at night?
It's been pretty consistent, but I'm getting around 6 hours.
That's not a lot. I would say that women do need a little bit of extra sleep. So how do you feel in the morning?
In the mornings, I am usually pretty tired. For about like the first hour and a half, and then that's usually when I start to get more energy.
Do you drink coffee?
Yeah, not every day though.
Okay. Any other stimulants that you're taking? Okay. So I'm going to ask you a few questions. I want to make sure that neurologically everything is okay. Can you please tell me today's date?
Today is October 9th.
Okay. And who is the current president?
It is Joe Biden.
Okay. What is 2 plus 3 plus 6?
11.
Okay. And can you count from 10 backwards every 2 digits?
10, 8, 6, 4, 2, 0.
Okay. Perfect. And so everything looks good. Alert and oriented ×3. You know exactly where you are and the circumstances. I'm going to take your vital signs. Have you noticed any hearing problems, hearing changes? Okay. Any facial pain? When was the last time you had a drink?
This morning when I woke up.
Okay. So we're going to take your temperature. This will be sublingual. We're going to put it under the tongue. I'm going to have you hold this for me. Perfect. And then this is going to measure your oxygenation and your heart rate. Good. And we'll take your blood pressure. I'm going to put it on your right arm. Okay, I'm going to have you relax. Uncross your legs for me, please. Perfect. Oxygenation is 97% on room air. Heart rate is very slow and relaxed. So, heart rate is 63, oxygen 97 on room air. Respiratory rate also very normal, 12. Let's go ahead and check. 97.7 Fahrenheit. Okay. Right. This is gonna go right in between the crevice here. Okay, I'm gonna have you relax. Okay. Blood pressure is a little bit low. 98/60. That might be one of the reasons why you're feeling a little bit lightheaded. I'm going to listen to your heart and lungs. Okay, you can go ahead and breathe normal. I can hear only S1 and S2. No S3, no S4. Go ahead and take a deep breath in and hold it for 3 seconds. 1, 2, and 3. Breathe out. Good. No murmurs were heard. Go ahead and breathe in and fully exhale. And again, breathe in and fully exhale. I'm gonna listen to the sides as well. This is gonna allow me to explore a little bit better the lower parts. Breathe in and exhale. Breathe in and exhale. Okay. Alright, I'm going to take a look at your hands and arms. So you can go ahead and relax this hand first. Okay, capillary refill is within 2 seconds. I'm not noticing any splinter hemorrhage or yellowish discoloration. And the nail beds look normal color. Sometimes we would see a lot of redness. There's no pitting edema. There's no signs of any liver problems. Okay, checking pulses. Just going to check and see if they synchronize. Good. And let's check this palm. I'm noticing a little bit of redness on the right side. Good capillary refill. Nail beds are normal, a little bit of white strings. That could be just from a little bit of trauma. Okay, I'm going to go ahead and slowly palpate the arm. I'm going to do a few tests once you lay down to check exactly the sensory problems that you're having. I'm going to check reflexes. Okay, that's good. Go ahead and relax your whole arm. Perfect. Good. Good. Okay, go ahead and relax. Good. Relax. Okay, perfect. There are a few things that I'm going to check first. Is your pupillary reaction to light, and then we're going to check for blurriness and peripheral vision loss. So go ahead and look right here straight at my nose. I'm going to flash a light in your eyes. Okay. I'm going to lower your eyelid. Okay. Now go ahead and follow the light with your eyes only. Don't move your head. Okay. Okay. Now go ahead and look right here for me. Not noticing any rapid eye moving. A little bit on the right side. That could just be a twitch. Go ahead and look right here. Okay. That was good. So I have here a few cards. Every card has a number or a shape on it. Go ahead and cover your right eye first. And can you tell me what number you see right here?
26.
Okay, now go ahead with your left index finger. Try to trace this S shape from one X to the other. Okay. What number do you see here?
98.
Okay, that's 96. Go ahead and do the same thing again. Okay. And what numbers do you see here?
42.
Okay. So let's go ahead and switch eyes. What number do you see here?
This one's a little blurry.
Okay. What about this one?
26.
Go ahead and trace this road for me. Okay, very good. That was good. And what number do you see here?
90. I can't really tell what the second number is.
Okay, that's okay. And lastly, can you trace this again? Okay, very good. Okay, go ahead and tell me what color you see here.
Orange. Yellow. Blue. Purple. Yellow. Pink. It's like a purple pink magenta.
Okay, now here I have a few pictures. I'm going to have you just give your fast interpretation. You don't have to think too much, just whatever comes in your mind the first moment that you see the picture. That should be good.
An eye. A dinosaur.
Okay.
A leaf. A frog. A rainbow. Lips. A lips again.
Okay. So the interpretation was pretty good, I would say. So neurologically there's nothing, that we should be continue focusing on. I'm going to check your optic nerve. Okay, go ahead and look straight behind me at the wall. I'm gonna come very close to your eye and take a look inside. Looking at the retina, optic disc, see if there is any inflammation. And this eye looks good. Okay, keep looking behind me at the wall. A little bit of redness behind the optic nerve. That could be putting a little bit of pressure and causing some of that blurriness. Okay, so let's check your ocular reflex now. What this entails is touching you with a very soft surface on the white part of your eye. We're looking for a very rapid movement or any kind of blinking, so you're not going to feel usually anything. Go ahead and look straight. Good. Go ahead and look straight. Very good. Okay. Go ahead and cover your right eye for me. And with your left hand, go ahead and hold this and extend your arm all the way. Perfect. Go ahead and try to read the last row, starting with the first letter to the left.
L, T, F, P, H.
Okay, what color do you see right here?
Red.
And here?
Green.
Okay, go ahead and read the second last row.
C, F, D, H, J.
Okay, let's go ahead and switch eyes. Okay, so we're going to do the same thing now. We're starting with the first letter towards your left.
L,
Right, I meant to say.
H, P, E, T, L.
Okay, and what about the second last row? Same thing, to start with the first letter towards the right.
J, H, O, F, O.
Okay, what color do you see here?
Red.
And here?
Green.
Okay, thank you very much. That looks good. Next thing that we're gonna do is to check your ears. And your hearing. Okay. Go ahead and look that way for me. You're just gonna feel a little bit the tip of the otoscope inside. The tympanic membrane is pro-gray. I'm not seeing any cerebrospinal fluid, so that's good. We'll do the same thing on the other side. Let me know if you feel any kind of pain. This is very swollen here. Are you experiencing any pain on the right side?
No, it might be because I slept with earbuds in.
That definitely could cause this type of problems, but I'm gonna have you lay down, change into a gown, and we will examine your hearing in detail to make sure that your hearing is not obstructed by the swelling. Okay. And then maybe we'll start an antibiotic treatment.
Alright, Sounds good.
I'm going to start by palpating your lymph nodes on both sides and checking submental lymph nodes for any inflammation. Posterior lymph node on the right side is a little bit swollen. Just gonna move the gown a little bit to the side. Can you lift yourself a tiny bit? One more time on the right shoulder. Perfect. So just slowly palpating right above the clavicles. There's another set of lymphatic tissue that we just want to make sure it's not swollen. Okay. Perfect. Okay. Soft tissue is normal, not feeling any fluid. Okay, I'm going to palpate your sinuses. We're checking for sinus infection that could put pressure on the nerve complexes around the face. Sometimes this can cause blurry vision. Okay, and I'm gonna feel my fingers right under your eyes on each side of the nose. Also, we're palpating around the eyes to see if there is anything that's putting pressure. Okay. A little bit of swelling on the left side. Okay. Scrub your skin. Okay, this is gonna feel a little bit wet. Just wiping the main areas that we're going to test. go ahead and tell me when you don't feel this vibration anymore.
No. No.
Okay. Go ahead and tell me which position here is louder. This is position 1 or 2. 1 or 2.
1.
Go ahead and tell me with which ear you hear this sound.
Right. Left. Both.
Okay. I'm going to put a few drops on your tongue. This is a piece of paper that has a very strong taste. Go ahead and tell me what that tastes like.
It tastes a little bitter.
Okay. Let's go ahead and try something else. And I'm going to put it on the other side of your tongue.
That one was sweeter.
Sweet. Okay. Go ahead and taste this one as well.
That one was really bitter.
Really bitter. Okay, so the taste is not obstructed. Now we're going to check your smell. Okay. Next, I'm going to check patency of your nares. Go ahead and breathe in, breathe out. Good. And again, breathe in, breathe out. Perfect. I have here a few scents. They're pretty strong, so if you have no obstruction and there's nothing going on at the nervous system, then you should have no problems in understanding the smell. Go ahead and keep your eyes closed and try to identify.
It's kind of vanilla.
Okay, so that one was vanilla. Let's try this one.
Kind of like a fruity smell.
That one's mint. Mint.
That one, I'm not sure, but it is pretty strong.
Okay, this one was garlic.
Oh, that one kind of smells like roses or some type of flower. I can't really smell that one. That one smells fresh. That smells like lilac. cinnamon. I'm not sure.
Okay, I'm just gonna bring it a little bit closer.
It kind of smells like the juicy fruit gum. I'm not sure what that scent is
Okay. Okay, now that the solution dried up, I'm going to do a few sensory tests. We're gonna start with changes in temperature. I'm going to touch you with two textures. One is going to feel cold and the other one is going to be warm. Go ahead and tell me if you feel cold or warm.
Cold. Cold. Warm. Cold. Cold. Warm. Warm. Cold. Cold. Warm. Warm. Cold. Cold. Warm. Cold. Warm. Cold. Warm. 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 Cold. Cold. Warm. Warm. Cold. Cold. Warm. Warm.
Okay. Now I'm going to touch you with two textures. One is going to feel a little bit sharp, but don't worry, it's not going to penetrate the skin in any way. And then the other one is going to be dull. It's going to be kind of like a fluffy sensation. So go ahead and tell me if you feel this sharp or dull.
Sure. Dull.
Excellent. So go ahead and tell me if you feel this sharp or dull.
Sure.
And does this feel sharp all the way?
Yeah. Dull. 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 Sure. Sure. Sure.
Okay, I'm going to move to the cheeks area.
Dull. Dull. Sure. Dull. Dull. Sure. Dull. 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 Sure. Sure. Sure.
Does this feel sharp all the way?
Yeah.
What about now?
Yeah.
Okay. Next, I'm going to touch you with two textures. One is going to feel dry, the other one is going to be wet. Okay, go ahead and tell me if you feel this wet or dry.
Dry. Wet. Dry. Dry.
Okay. Now, what I'm going to do is I'll mix all of these together. So we have about 6 sensations that we're going to check in the same time. We're going to have warm, cold, sharp, dull, and wet and dry.
Dry. Wet. Sharp. Dry. Wet. Dull. Dry. Dull. Wet. Cold. Dull. Sharp. Wet. Dull. Dry. Wet. Wet. Dry. 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 Dull. Dull. Dry. Sharp. Sharp.
Now I'm going to focus on the hairline as well, and then we'll check the scalp. Go ahead and tell me if you feel this sharp or dull.
Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Sharp.
Okay, a little bit of sensory problems there. So now I'm going to check your scalp. Okay, I'm noticing a lot of redness on the scalp area. So I'm guessing that this is where you keep your part, correct?
Yeah.
In the middle.
Yeah.
Looks like sun exposure. It's also a little bit dry and flaky. Okay, I'm gonna be very gentle on this part so that we do not infuriate the skin any further. Go ahead and tell me if you feel this sharp or dull.
Sharp. Sharp. Dull. Wait, I'm so sorry. Are you still doing it?
No, that's okay. So yeah, there's a little bit of sensation loss on the sides. Did you feel that?
Not really.
What about now?
Yeah, I do feel that.
Okay, let's do that one more time. Did you feel that?
Yeah.
Was that sharp or dull?
Sharp.
Okay. Sharp or dull?
Sharp.
Okay. Go ahead and tell me if you feel this sharp all the way. Was there any part where it didn't feel sharp?
Toward the beginning.
Towards the beginning. Okay, go ahead and tell me if you feel this warm or cold.
Warm.
Warm. Good. And does this feel warm or cold?
Warm.
What about now?
Cold.
Warm or cold?
Warm.
Warm. And now?
Warm. Cold.
Okay. Go ahead and tell me if you feel this 1, 2, or 3 taps.
1, 2, 1, 3, 1, 2.
Okay, and go ahead and tell me if you feel this 1 or 2 pressure points.
1. Yeah, I can feel that.
Do you feel that 1 or 2?
1. 1. 2. 2. 1. 1. 1. 1.
Okay, go ahead and turn your head towards your left. Perfect. Okay. There's some redness on the right side of the cranium as well. Go ahead and tell me if you feel this too. 1, 2, or 3 taps.
1. 2.
Okay.
1. 2. 2. 3.
And does this feel sharp or dull?
Sharp. 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 Cool. And sharp. Sharp. Sharp.
So both of them were sharp. Does this feel 2 or 1 pressure point?
1. 1. 1. 1. 1. 1. 1. 1. 2. 1. 1.
Okay. I'm going to switch to the left side. Go on and turn your head whenever you're ready. ahead and tell me if you feel this sharp or dull.
No. Sharp. 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 Dull. Sharp.
And does this feel sharp all the way? Does this feel cold or warm?
Cold. 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 Warm. Warm. Warm.
Do you feel this 2 or 1?
1, 2, 1, 1, 2, 2.
Very good. Okay, I'm going to go ahead and check the sensation on your arms now. Alright, so the one on the right, kind of on this side, you showed me that you're having more tingling sensations.
Yeah.
Okay. Go ahead and have your eyes closed and tell me if you feel this on the left or right.
Right. Left. Right. 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 Left. 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 Right.
Okay, now go ahead and tell me if you feel this all the way down.
Yeah.
Okay, same thing on the other side.
When it gets to the crease of my elbow, I can't really feel.
Over here.
Yeah.
I'm going to touch you with 2 pressure points, but I need you to tell me if you feel 2 or 1, okay?
Okay. 1, 2, 1, 1, 1, 1, 1, 1, 1, and 1, 2, 2, 2, 2, 2.
Okay.
1, 2, 1, 1, 2, 1, 1, 1, 1, 1, 1, 1.
Go ahead and tell me if you feel this on the left or right.
Left. 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 Right. Right. Right.
Does this feel sharp or dull?
Sharp.
Okay. Go ahead and tell me if you feel this sharp all the way down.
Yeah.
And does this feel sharp or dull?
Sharp.
Go ahead and tell me if you feel this sharp all the way down.
It's the same spot that I couldn't feel it.
Okay. Now that you're laying down, I'm going to check your reflexes again. Good. 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 Relax your arm. Good. Okay. Go ahead and squeeze my fingers, please. Okay. And go ahead and try to catch my thumb. Okay, very good. Okay, perfect. Okay, you're gonna feel my hands just kind of wrapped around the tibia here. Just slowly palpating. We're looking for any edema. Gonna slide my fingers right under. Go ahead and relax. Okay. Okay. Going to check your Babinski reflex. So it's gonna feel a little bit sharp, okay? Good. Negative on the right side. And left side as well. Let's go ahead and check pulses. Okay, penile pulses are 2+, strong and synchronized. Okay. Normal temperature. Capillary refill is within 2 seconds, so that's very good. Let's go ahead and do a sensory test. One is going to feel wet, the other one is going to be dry. Go ahead and tell me if you feel this wet or dry.
Wet. Dry. Wet. Dry. 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 Wet. Dry. Wet. 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 Dry. Dry. Wet. Wet. Wet.
Okay. Okay, go ahead and tell me if you feel this warm or cold.
Warm. Cold.
Okay.
Cold. Cold.
Okay. Does this feel warm all the way?
Yeah.
And what about now?
Yes.
Does this feel cold all the way?
No.
Where does it stop feeling cold?
Just about there.
Okay. And does this feel cold all the way?
Yeah.
Okay, so mainly on the left side. Go ahead and tell me in which direction your toe is moving, towards you or towards the wall in front of you.
Towards the wall. Me. Me. The wall. Me. The wall. The wall. Me. The wall. Me.
Go ahead and wiggle your left toes. Okay. Same thing on this side.
Me. The wall. Me. Me. The wall. The wall. The wall. Me. The wall.
Okay. Wiggle your right toes. Okay. Go ahead and push with the pads towards me. Okay, I'm gonna slide my hands under your heels. Go ahead and push down. Okay. I'm gonna try to open the legs. Don't let me do that. Good. And I'm gonna slide my hand under your leg. Go ahead and push down. Good. Same thing, push down. Good. 1 second. Let's do both at the same time. Push down. Got a little bit of weakness on the left side. Okay, so let's go ahead and check your back and see if there's any spinal cord issues. I'm going to start by palpating your cervical spine. Just going to go ahead and feel for any popping sensations. I'm going to start by palpating your cervical spine. We're looking for any crepitus, any ganglions that might be swollen. Let me know if you feel any kind of pain. I'm noticing there's a little bit of decreased movement towards the end of the thoracic spine. No signs of scoliosis. I'm going to check for neurological deficits. You have normal movement in the spine muscles. I'm going to listen to your lungs and then your spine. Go ahead and take a deep breath in and exhale. And again, breathe in and exhale. breathe in, breathe out. And again, breathe in, breathe out. One more time, breathe in, breathe out. And again, breathe in, breathe out. Okay, I'm going to listen to your spine now. I'm going to try to see if there are any loud sounds coming from fine movement of the vertebrae. Go ahead and tell me if you feel this 2 or 1 pressure point.
1, 1, 1, 1, 1, 1, 1, 1, 1, 2, 2, 2, 2.
Do you feel this on the left or right?
Left, right, right, left, right, left, middle, middle, middle.
Okay, very good. And go ahead and tell me if you feel this cold or warm.
Warm, cold, cold, warm, warm, cold.
Does this feel warm all the way down?
Yes,
What about now?
yes,
Does this feel cold all the way to the right?
yes,
And now?
yes,
Does this feel cold all the way down?
yes,
And now?
yes.
Go ahead and tell me when you don't feel the vibration anymore.
No, 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 no,
Okay. Go ahead and tell me if you feel this sharp or dull.
Sharp. 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 Dull.
Does this feel sharp all the way down?
Yeah.
Okay. Does this feel sharp or dull?
Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp.
Does this feel dull all the way up?
Yeah.
And does this feel dull all the way to the left?
Yeah.
Okay. So we're gonna end this here. We're just gonna do the outro. You standing up. Okay, Angelina. So I don't have good news. I don't think this is neurological. I think we're having an endocrinology problem. So we're gonna have to do some hormonal check. We're gonna do a blood test of the hormone levels, and I'm going to prescribe something that helps with stress. This will lower your stress level throughout the whole body, and within a month or two, you're gonna feel a huge difference. Your vision is gonna come back to normal, and also you're not gonna feel all of that tingling sensation that's not also supposed to be there as well. So I'm gonna prescribe 3 supplements. And I'm gonna have you take them every day for the next 28 days. We're gonna see how your hormone balance comes back to normal, and we'll go from there, okay?
Sounds good. Thank you.
You're welcome. Thanks for coming in. Hi, Luna.
Hi, Dr. Matt.
How are you doing?
I'm doing okay.
Okay. Thanks for coming in. So I see here that you do have a few symptoms that we should examine today. Before we begin, can you please verify your date of birth and your last name?
Yes. Date of birth is February 1st, 1992. Luna Lux ASMR.
Okay. Do you have any new allergies?
No.
Okay. Are you taking any medications on a daily basis?
I'm taking some magnesium at night, as well as melatonin occasionally, and probiotics.
Okay. Are you experiencing any side effects from these?
No.
Okay. And what kind of symptoms are you experiencing at the moment?
Some weird sensations that I've never had before, tingling on my face, specifically around the mouth.
Okay. For how long has that been going on?
I've noticed it the first time maybe a month ago, and I thought it was going to eventually resolve itself,
Okay.
but it hasn't, which is why I'm here.
Okay.
And I've also been feeling numbness around the abdomen.
Do these symptoms start about at the same time?
I would say so, yes. Maybe within a couple of days of each other.
Okay. Any new stressors in your life at the moment?
I wouldn't say so. Nothing out of the ordinary, no.
Okay. So we do want to check you for vitamin B12 deficiency. Sometimes that could cause it. What about on other parts of your body? Have you noticed any numbness?
In the face and maybe sometimes around the hairline. Sometimes when I touch my hair, I can just feel that sensation around the hairline.
Okay, what's your approximate height and weight?
5'5", and weight is about 128, 130 pounds.
Okay, perfect. So I'm just going to insert here some information. We said you're 5'5". Weight fluctuates around 130, 128 to 130. Okay, so you're in perfect BMI. And in case we do need to send some medications for you, what is your preferred pharmacy?
I don't have one, so you can just give me the paper prescription and whichever one I find myself closest to, I'll go to that one.
Perfect. I'm going to go ahead and sanitize my hands and we'll begin a quick vital sign check. Have you noticed any flu-like symptoms?
I've had a little bit of a runny nose, comes and goes, and maybe a headache a couple of days ago, very unexplained.
And do you usually have headaches or not very often?
Not very often, not without just any explanation.
Okay. I'm going to put this inside your mouth, okay? And I'm going to have you hold it for me. Perfect. I'm going to put this on your index finger. Excellent. Go ahead and relax. I'm going to measure your pulse oximeter. Oxygenation is 98% on room air. Heart rate a little bit elevated, 91. Let's go ahead and check temperature. You can go ahead and remove 97.7. This is going to go on your arm. Yes, perfect. So it's going to give you like a big squeeze. You can have you relax your arm. That's excellent. Okay. Alright, blood pressure is 125/60. That's very normal. to go ahead and slide this down. Okay. Okay, blood pressure was 125 over 60. So I would be a little bit concerned about the heart rate being kind of elevated. I'm going to go ahead and check your taste and your sense of smell. But first, let's make sure that anatomically everything looks good. So I'm going to put some gloves on. Go ahead and open your mouth for me, please. Are you experiencing any pain when doing that?
A little bit, yeah.
Okay.
Some tingling sensations, maybe around my jawline, I would say.
Okay, we're going to go ahead and check that as well. Any changes with your sense of taste?
No, I've not noticed anything.
Okay, go ahead and try the taste test and let me know what that tastes like.
Bitter.
Okay. Okay, let's go ahead and try that again.
That tastes like lemon, so acrid, sour.
Sour. Okay, let's try that last one.
That's sweet.
Okay.
That's bitter again. Bitter.
Okay, so I'm not noticing any abnormalities there. Now I'm going to go ahead and palpate your nose. So I'm going to check for patency and see if there is any obstruction. Okay, go ahead and breathe in, breathe out. And breathe in, breathe out. Excellent. Okay, I have here a few smells. These are very normal smells that most of the people find them very common. What I'm going to have you do, I'll have you close your eyes and try to breathe in through your nose and exhale through your mouth. Is that a little bit too strong?
Wow, that is very strong. That smells like lemon balm, I think.
Okay, so now I'm going to go ahead and do the same thing, but I'll have it a little bit farther from your nose. Breathe in and breathe out.
It smells like lemons.
Okay. And on the same thing, I'll have it even farther from your nose.
I'm not smelling anything there.
Take your time. Sometimes it may take a few seconds for the brain to register new smells.
Yeah. It smells like mint.
Okay. Very good. I'm going to check your pupils now. Are you wearing contacts?
Yes.
Okay. So go ahead and tell me if the light bothers you a lot, okay? Keep looking at my nose. I'm going to shine a light in your eyes. Okay. Now I'm going to place my hand on the side of your face. Go ahead and look right here. Okay, no rhythmic changes. Now look here. Okay. Very good. Go ahead and follow my finger with your eyes only. Don't move your head. Any pain?
A little bit, especially as I'm moving toward the periphery here. I'd say a little bit, maybe a 2.
Okay. And is this for the first time that you're experiencing this type of pain?
Yeah, I've never noticed that before.
Okay. I'm gonna have you change into a gown.
Okay.
And I'll have you go on the table whenever you're ready. And we'll start doing a full body sensory exam to make sure that all 12 cranial nerves are intact as well, okay?
Okay.
Okay, Luna, I'm going to go ahead and start by palpating the hairline. Palpating sinuses right in between your eyebrows. Going to palpate sinuses right below your eyes now. Looking for any type of swelling or tenderness. Palpating lymph nodes for any lymphadenopathy. And also to see if there is any nodules on the masseter muscle. And checking TMJ. Any pain when I'm palpating here?
A little bit, yeah.
1, 2, or 3?
About a 2.
1, 2, or 3?
2.
One, 2, or 3?
No pain there.
Okay. Post-auricular lymph nodes are non-enlarged. Moving down the neckline, check for any swelling. Just slowly palpating above the clavicle. Okay, palpating occipital lobes, starting with the right side. Any pain here?
No.
Any pain here?
No.
Okay. Going to check neurological reflexes. It's going to feel like a light tapping. I'm going to have you relax your jaw just a tiny bit. Perfect. Good. Okay, to check for any fluid retention. Go ahead and tell me if you feel this on the left or right.
Right. Left. Right. 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 Left. 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 Right. 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 Center. Left. Left. Left.
Okay. Go ahead and tell me if you feel this equally on both sides.
Yes. 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 Yes.
Okay. I'm going to listen to your heart and lungs. Is it okay if I slide the stethoscope under the gown?
Yes.
definitely breathe normal. You don't have to take deep breaths in. I can hear only S1 and S2. No S3, no S4. Go ahead and take a deep breath in and exhale. Okay. I'm going to check your jugular vein as well. Go ahead and breathe in and keep it in for 3 seconds. 1, 2, 3. Breathe out. And same thing on the other side. And hold it in for 1, 2, 3. Breathe out. Very good. I couldn't hear any breathing. I'm going to check your scalp for any sensory issues first. I'm not noticing any redness on the scalp. Okay. The hair follicle looks very healthy. There's no residue, so that means that it's very well implanted into the scalp area. Go ahead and tell me if you feel this sharp all the way.
Yes.
And does this feel cold or warm?
Cold. Warm. Warm.
Okay. I'm going to touch you with 2 textures. One is going to feel sharp, the other one's going to be dull. Does this feel sharp or dull? What about now?
Sharp. Dull. 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 Dull.
Go ahead and tell me if this feels wet or dry.
Right.
Good. Does this feel wet all the way down?
Yes.
Good. Does this feel wet or dry?
Wet. Wet.
And does this feel wet all the way down?
Yes.
Go ahead and tell me when you don't feel the vibration anymore.
Yeah. Yeah. Yeah.
Okay. And does this feel sharp or dull? Dull. What about now? Okay. And now? Dull. So as we go towards the center of the scalp, it seems like the sensory problem disappears. Seems to be more localized towards the front. Do you feel this sharp or dull?
Dull. Sharp. Sharp.
Okay, and a little bit of hypersensory stimulation. Okay, are you experiencing any hypersensitivity on the left side?
No, I don't think so, no.
Okay, go on and tell me if this feels warm or cold.
Cold. Cold. Cold.
Perfect. And do you feel this wet or dry?
Wet. Wet.
And does this feel wet all the way?
Yes.
Okay. And do you feel this sharp or dull?
Sharp. Sharp. Sharp.
Okay, go ahead and turn your head towards the left. Perfect. Okay, a little bit of redness compared with the left side. a sample from here. Go ahead and tell me if you feel this sharp or dull. And does this feel cold or warm? A little bit of redness as we go towards the ear. Have you noticed any burning sensation or itchiness?
Burning sensation that goes and goes.
Okay. Let's go ahead and examine your back and your abdomen next. Okay, Luna, I'm going to go ahead and lift your gown up and examine your abdomen. Looking for any asymmetry, redness, or lumps that are visible. And I'm not noticing anything abnormal. Examining for any pulsations. Okay. Go ahead and get a wooden spatula so that we can check for any sudden movements and skin lesions. Okay. Go ahead and tell me if you feel this cold or warm.
Cold. Cold.
And does this feel on the left or right of your abdomen? Okay, perfect. Go ahead and tell me if you feel this wet or dry.
Right. Right.
And does this feel sharp or dull?
Sure. 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 Don't. Don't. Sure. Sure. Don't. Sure. Don't. Don't. Sure. Sure. Don't. Sure. Don't. Sure. Sure.
Not noticing any sensory issues on the abdomen area at this side. I'm going to go ahead and first auscultate with the stethoscope. So this is going to feel a little bit cold. kind of feel like a light tapping now. Okay, I'm going to apply a little bit of gentle palpation. I'm looking for any swelling. Okay, perfect. I'm gonna have you turn around and we'll examine your back now. I'm going to start by palpating your spine. I want to check if there is any neurological inflammation coming from the vertebrae and spinal cord. I'm definitely noticing a slight redness. That could indicate inflammation in the body. A little bit of swelling on the right side as we're approaching D5. Okay, I'm going to check for swelling and vitamin deficiency. This also shows hydration status. A little bit more redness on the left side. And that could be a lack of oxygenation and a decrease in red blood cells. noticing slight redness. So we're gonna have to run some labs. Okay, no edema. Perfect. So we're going to check vibrations. Can you please tell me if you feel this on the left or right? Okay. Go ahead and tell me when you don't feel this vibration anymore.
No. No. No.
Perfect. Next, you're going to feel a puff of air. Go ahead and tell me on which side of your back you feel it, right or left. Perfect. Now go ahead and tell me what letter I'm drawing. I think that will give me a better understanding.
Oh.
Perfect. What about now? Try that again. Give yourself a few seconds for your body to register the movement. Perfect. Okay, so I'm not worried at the level of the thoracic area that there's any sensory problem. I'm going to check cervical now. What letter am I drawing now? So take your time. Let your mind clear out so that your nervous system can relax and register the letter that we are drawing at the end of your cervical spine.
Right.
Okay, perfect. I'm going to listen to your back. You want to make sure that there is no inflammation. You can breathe just normal. Trying to see if there's any signs of empyema. Okay. It's going to feel light tapping. No pulmonary problems. I'm going to go ahead and check your legs and your feet now. Okay, I'm going to slowly palpate, checking pedal pulses. The right side is a little bit stronger than the left. Checking for any edema. Okay. Go ahead and wiggle your toes for me. Excellent. And I'm going to move your toe either towards you or towards me. Go ahead and tell me which way it's going, okay?
Towards me. Towards you.
Okay.
Towards me. Towards you.
Okay, perfect. And I'm going to put my fingers under your toes. Go ahead and curl them. Curl them around my fingers. Okay, perfect. Okay, now go ahead and push with the pads towards me. Good. And pull your feet towards you. Okay, good. I'm going to slide my hands under your heels. Go ahead and push with the heels. Okay, Very strong and symmetric there. I'm gonna try to open your legs. Don't let me do that. Good. I'm gonna try to close them. Don't let me do that. Okay, perfect. Now I'm going to slide my hand under. Go ahead and I'm gonna try to push your leg down. Don't let me do that, okay? Good. Same thing. Okay, perfect. I'm going to check your reflexes. Okay, a little bit diminished on the right side. Okay, I'm going to check your Babinski reflex. Go ahead and relax your foot. Good. Okay, relax. Okay. Go ahead and tell me if you feel this on the left or right.
Left. Right. 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 Right.
Okay. Go ahead and tell me if you feel this puff of air on the right or left side.
Left. Left. Left.
Good.
Right. Right. Right.
Okay. And does this feel sharp or dull?
Sharp.
Does this feel sharp all the way?
Yes.
Okay, what about now? Is this sharp or dull?
Sharp.
Is it sharp all the way?
Yes.
Okay. Does this feel sharp or dull?
Sharp. 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 Sharp.
Okay. Perfect. I'm gonna have you sit on the table and we'll discuss the results. Let me go ahead and remove my gloves. So I'm gonna have you do a CT scan of the upper spine. I did find some cranial nerves that might be a little bit inflamed, so we want to make sure that there's nothing compressing on the spine and that we don't need to do any invasive procedures to alleviate some of that distress that you're having. Do you have any questions for me?
Is there anything else I should be doing when I'm going home that might help?
So far, I don't have a definitive response in regards to the diagnosis. So let's see what the CT scan results show, and we'll go from there. You don't need to do anything unless you're experiencing pain. You can take ibuprofen or Tylenol for that at the moment. If the pain is too much, just let me know.
Okay, thank you so much, Dr.
You're
Mott.
welcome. Thank you, Luna. Okay, see you soon.